Looking good, feeling better.
Her steps are bigger.
Stand up
They are.
straight as you
Her
can.
steps are bigger.
A lot faster pace.
Straight as you can.
Strides, her stride length was a lot more consistent, and the pace of her gait was a lot quicker pace.
Her muscle tone was high, pretty high. She had, and her fingers, they were it's stretchable contracture, but now it's easier for me to straighten it out. It was more kind of fisted, but it's not as fisted now. Can you move it up? Can you show me if you can raise it up? She's going up higher. She's going up higher on that.
It was amazing. She was more stimulated when she came off of the Quadriciser. Her feet were not red nor blue. They were perfectly as white, and the circulation was just like ours would be. So I am very happy.
Well, after severe disabling conditions that cause paralysis, people are not moving. Their muscles can get atrophic, and they suffer many serious side effects of the deconditioning, such as loss of calcium from their bones, problems with circulation, and depression. And when a limb is shortened, not only does it just shorten, but the blood vessels are shortened, the muscle will shorten, the nerves will shorten, and the joint will shorten. So it's much harder later to bring it out again. And sometimes it's even possible, even with surgery.
Look at how
After one time on
after
there.
one time, look at this. His hand was like this. You couldn't even.
Oh, you couldn't
do
even
this.
like bend it if you
No.
felt like you were going to break the fingers.
I could never do this with his fingers.
Nope.
There's no way. No way in heck. Look at that. And even his wrist. I mean, his wrist was. Look at that.
I mean, at least there's something to work with now.
Yes, but so look at this arm too. This arm is never lays like this. Never. There's no way this arm ever lays like this.
Really?
Yeah, no, it's always up.
He's looking at that.
It's always up like this. It's always like that.
Okay.
He's usually totally flexed in a totally closed fist position. It's a lot easier now to open it, like
Now you
passively
have something
open
to work
it.
with.
Can you open your hands? Good.
Look at that. Oh my God. So
Well, I would continue with the Quadriciser to get that going, but now passively I probably can open up his hand more.
The experience that I've had with the Quadriciser has yielded a lot of positive results in my interaction with it and with patients. I found over the past 10 years that there really did not exist particular and specific pieces of equipment that would work the various ranges of motion, the functional movements that the Quadriciser does, particularly with the specific patient population that we tend to incorporate. Whether you've had spinal cord injuries, neurologic damage, whether it be from a stroke or some other debilitating illness, the Quadriciser fills a needed and valuable gap in the system as far as therapy with relation to what it's able to do. The Quadriciser is an excellent tool to assist the physical therapist. And I say it's a tool because it's very important to recognize that it is a tool in the hands of a skilled physical therapist can be a perfect adjunct in the treatment plan.
And I believe what the Quadriciser does is really engage the brain. It's engaging the brain in the reciprocal relationships that are in the body. And so it's really, really working on the ability for the brain to engage and to get that re-education going in the patient that's been affected with Parkinson's. That's beautiful on Parkinson's disease. I've heard patients say, there's one guy that I've got on there now says, I feel like I'm walking. I'm walking. And he goes, it's beautiful because I don't have to think. So it's really great.
I can do an extension physically for someone who's contracted, but it's very labor intensive and it takes an enormous amount of time. This machine allows to be able to adjust and work on the machine to work on extension.
Personally, I think it's great for us that work here because it's taken a lot of load off of physically having to do all the patterning ourselves. So it's great